vision. Rosenbaum is the near vision. That's
so a
little card where you hold it at reading distance.
Are we doing that too? Okay, so
Yep. Near and far vision. Okay, and you do both eyes together and then each eye individually for each of those. And then your Ishihara plates are your color vision. You have to trace the shape, follow the line from X to X. That's your color vision, Ishihara. Okay. Confrontation. Who remembers what confrontation is? Peripheral vision. So I have them look straight ahead at my nose. Don't move your head or your eyes. Just look straight ahead at me.
Okay.
Okay. So that's 180. I like to do it individually because then I can tell which eye she's saying now to. If you do it together, it's hard to determine if she's really saying both of them at the same time.
Yeah.
So I like to do it individually. Okay. Then we have position and alignment of eyes. The eye should be about 1/3 of the way down the face and one eye width apart, so she has normal alignment and position. Then I took my gloves off, I should have left them on. I went through so many gloves this morning. Next I look at the eyelids and the lacrimal glands. So the eyelids should be normal skin tone. They shouldn't be overly red. They shouldn't be puffy. They shouldn't have drainage or crusting. They should be, eyelashes should be turned outward. Okay. Then it's not uncommon to see a lot of darkened skin under here, especially in your people. And your people that have chronic allergies will have shiners all the time. We actually call them allergic shiners because it's dark there all the time. So that's not an uncommon finding. It's not normal, but it's not uncommon. Okay. So I'm just going to gently palpate. I usually start at the inner canthus and work my way out. Is there any tenderness at all? No. And then I work my way back in. I just kind of squeeze up here a little bit because I want to see if there's any abnormal discharge out of that tear duct. Okay. Then while I'm there, I'm going to pull down her lower lids and I'm going to look at the palpebral conjunctiva, and that should be nice and pink. It shouldn't be pale. Mine are probably kind of pale, but it should be a nice pink, healthy color. Okay. What would pale indicate?
Anemic.
Okay. And then I'm going to grab my pen light. And I'm going to look at the structures of the eyes itself. So I want to make sure that the irises are equal in size, they're the same color, they're not an irregular shape. Same with the pupils, they should be both round, same shape, same size. And I'm looking at the sclera, the white part of the eye should be a pearly white to a grayish pearly color. And the covering over the eye should be clear. And if I look from the sides, the lenses should be clear. Okay, and people with cataracts, those lenses are going to be cloudy. It'll look fuzzy. Have kind of like a cottony look to it. Be cloudy and fuzzy. Okay, so those are the main structures that we're looking for. Then we do our perla, right? We're looking for pupils equal, round, reactive to light, and accommodation. So the pupils are equal size. They're both round. I want to check responsive to light. And if I was in a room where I could shut the light off, make it dark, I would do that because it's just easier to see the pupil reaction. I'm going to come in from the side. And this one should constrict, but this one should as well, right? Direct and consensual. And I'm going to do the same thing on this side. Both of them should constrict and then dilate. Okay? So that's your reactive to light. Then accommodation, I'm going to have her look at a distant point in the wall and then at the pen. You see how her eyes converged? Her eyes should converge and her pupils should constrict. Again, from far to near. Okay? Eyes should converge across and the pupils should constrict. That's accommodation. That's your A of perla. Cardinal positions of gaze. What are we testing?
The ocular window. No.
Yeah. So we're testing cranial nerves 3, 4, and 6.
Do we need to verbalize that? It's like if we get the eyes, do we need to verbalize that?
Yeah.
Okay.
Yep. And we're testing the extraocular muscles. Okay, so they should be working as a pair. They should be tracking together. At this point, I'm also looking for nystagmus. Even though it's part of my neuro, I'm doing it when I do eyes because that's the easiest way to test for it is when you're doing cardinal positions of gaze. So who remembers what nystagmus would look like?
So twitching,
jerking, or pendular movements of the eyes. Okay, so I do 8 positions. Some books say 6, some say 8. And I always go back to center after each position change. So I'm going to start in the middle, follow my finger with your eyes, don't move your head. Okay? And go nice and slow, otherwise your patient's going to get dizzy and confused. And I go diagonals first. What happened there?
I'm not cross-eyed.
Okay, so the eyes worked as a pair and there was no nystagmus. Okay, we already did iris and pupils and we did perla, so that's it for eyes. Okay, a lot of overlap with cranial nerve.
Yeah.
The wall thing, what was that?
That's accommodation. Look at a far point at the wall and then at a close point. The eyes should converge and the pupils should constrict. Next we move on to the ears, and I'm going to look at the auricles first, the outer part of the ear. I'm trying to do it on this side. Okay, so I'm just inspecting the whole external part of the ear. Then I'm going to take my pen light and I'm just going to shine it in the canal here. And I'm looking for any redness, swelling, flaking, irritation, discharge, crusting, anything that's not normal. I also like to pull back on this and kind of move it around. You have any tenderness with that? And push on the tragus. You have any tenderness with that? Okay. Summertime's a big deal for that. All the swimmers' ears. So my son had both of those problems when we were in Florida. I mean, I couldn't barely even touch his ear, and he was like, "Wah!" And his ear canal was all swollen and red and sticky. It was left to wet and moist. Just was nasty. Okay, so that's that. Then we move on to the voice test, which is the same as the whisper test. You should be in about 3 feet, arm's length. Plug your right ear for me, and I'm going to say 3 words and have you repeat them.
Cat, dog, horse.
Okay, plug this ear. Shoe, car, house.
Shoe, car, house.
Yep. Okay, so that's your whisper test or your voice test. Okay. Weber and Wren. What does a normal Weber test look like?
Equal sounding, both ears.
Yes. Okay, so I'm going to strike the tuning fork, place it on your head, and you should feel it equally in both ears.
Yes.
Okay, an abnormal test would be called lateralization to one side or the other. I have an abnormal. Mine lateralizes to one side. Usually this side. It's a little different today, but so I had Lyme disease that affected neuro. I had neuro symptoms with it, so I know I have hearing loss in this ear. In normal practice, if Weber was normal, you would not do Rin, however you want to say it. But for your purposes, you have to demonstrate both. So even though her Weber was normal, I'm still going to do Rin, and it looks like this. I strike the tuning fork, place this part on the mastoid bone behind the ear. I instruct the patient before I do that, just let me know when she stops hearing the sound or feeling the vibration, and then when she indicates that, I move the tuning fork. So I'm counting every time I put it there, and then when I move it in the front, I start counting new. Which should be longer, bone or air?
Air.
Okay, so let's do that.
Okay.
It was just about 2 to 1. It was 20 to 12, so I would call that 2 to 1. Now, if you do mine, I'm 9 to 7. so I know I have air conduction problem. Okay? So that's what that looks like, and you would do it on both ears for red. Okay? So that is it on ears. We good?